I'm Juliana Orsini, and this is our first case study.
I'm Taylor Vincent.
So first we assess the problems with our patient based off of his blood panel. Some risk factors are age, physical activity, obesity, type 2 diabetes, stage 1 hypertension, and dyslipidemia. Our patient is 72 years old, so age is a factor. He has no regular physical activity or exercise, and his resting heart rate is 78 beats per minute. He is classified as obese. His waist girth is 40 inches and his BMI is 41.2 kilograms. He has a fasting glucose of 156 milligrams per deciliter. So he is classified as type 2 diabetes. His systolic is 138 and diastolic is 72. So he's classified as stage 1 hypertension. And his LDL, HDL, and total cholesterol indicate that he has dyslipidemia. And he has a metabolic syndrome because he has multiple risk factors. And this defining criteria was drawn from ACSM. Some considerations for our patient is osteoarthritis because he is overweight. There's more pressure on his joints, coronary artery disease, congestive heart failure, chronic kidney disease, retinopathy, and myocardial infarction. So we need to be aware of any chest pain or signs and symptoms that he's having when he is exercising. For testing, body composition, BMI, and waist circumference were both calculated, so we are not going to do any further testing because he is classified as obese. Flexibility is going to be assessed with the sit and reach test, strength and muscular endurance with a 30-second curl test, and cardiovascular endurance with the 6-minute walking test.
So for our exercise intervention, we're going to start with 2 days during the week and then slowly progress into 3 days a week of a mixture of aerobic as well as strength and flexibility due to the fact that he is completely sedentary at the moment. We don't want to, overwhelm him with too much. So for day one, we have walking in the pool, bench press, seated calf raise, shoulder press, step up, and then a walking in the pool as well to cool down. And we also have side bends and hamstring stretch. So you can see as the weeks go on from 1, 2 to 3 that we're increasing slightly from the sets and rep range from 2 to 8 to 2 to 10 in week 2, and then in week 3, 2 to 12, as well as the time in the pool walking to start with from 7 minutes to 10 to 13. And that is at 40% heart rate to begin at 7 minutes, and then increasing to 50% of the heart rate at 10 minutes in week 2, and then 50% heart rate again in week 3. And then for the walking the pool to cool down, side bends and hamstring stretch, we're keeping those even across. Those are, for cool down as well as just working in some flexibility. And then if we go to day 2, we have the stationary bike as well as sit to stand from a chair, banded chest cross, leg press, seated pull down, stationary biking again to cool down, calf stretch, and quad stretch. Now we picked the pool and the biking just to pick exercises that weren't going to produce as much force on the joints because at the moment he is completely sedentary. So we want to keep the injury risk as low as possible for him, especially considering his BMI. So that's why we chose those. And those, again, as you can see, are progressing between weeks from 1, 2 to 3, increasing in sets and reps for some of them. And then, of course, the cool down and the stretching we kept it the same because those are, more for flexibility and cooling down, like I just said. So these are all backed by different researches and studies that you can see here in our references, as well as guidelines from ACSM that we followed for these.